In the words of Byron McGill, when life gets blurry, adjust your vision. On today's edition of Better Eat Today, we intend to draw attention on the silent thief of sight. Yes, experts refers to it as sneak thief of sight, glaucoma. Yes. We have a consultant ophthalmologist to provide proper education and enlightenment on glaucoma. First, our crew members went on the streets to interact with the public on the subject matter. See you at the other side.
The long I've done eye test last. Well, since I don't have any issues with my eyes, I see clearly, I read very well, and I can see very well.
Yes, I have issue of is it short or long side reading?
Well, sometimes I do have some eyes inches. If not, I don't have much problem, but I feel I should go for test so that I should know the condition of my eyes.
In fact, I've had like 2 or 3 cases like that. Even a friend of mine that's close to me, I had that. But I learned that maybe it's caused by glaucoma or this and that.
I have somebody that I even lost her, a cousin, because she was having that glaucoma, but we don't know. The eye is normal. If you see the eye, there's nothing that shows that she has issue. She will not be seeing. She will be telling me, "Auntie, I'm not seeing you well." I say, "We'll take her to the hospital. They will check. They will say there is nothing." Then later on, she now totally just missed. We went to several hospitals. They now say there is nothing they can do on the eye. Then later on, we now start seeing the feature of that glaucoma coming out. You know, the sign used to come out white.
So many of my friends, they are suffering from eye defect problems. And I know so many of them are still in villages and even within this environment in the town here, which need medical attention. Some of them does not have the means to go for the test. And those who have the means, those who have the capacity, have been going for tests so that they can see themselves through out of the problem.
As individuals, conscious effort on our health is of utmost essence. Experts advocate that getting tested or subjecting oneself to a comprehensive eye examination is a sure way not to be blindsided by glaucoma. It is now time for a report on glaucoma. Please watch.
Glaucoma is a leading cause of irreversible blindness worldwide, and it is estimated that the number of people with glaucoma will rise from 76 million in 2020 to 111 million in 2040. Glaucoma is more prevalent in developing countries and is often diagnosed at a later stage, leading to more advanced disease at the time of presentation. In some developing countries, up to 90% of glaucoma cases are undetected. According to the Global Burden of Disease Study, one of its studies that assessed the global health burden of glaucoma from 1990 to 2019 showed that the health burden of glaucoma has continued to increase over the past 25 years and is unevenly distributed. Lower income levels, higher age, females, and so on were significantly associated with the higher glaucoma burden. The visual impairment caused by glaucoma results in significant economic losses and reduced health-related quality of life. Since glaucoma is one of the main causes of vision loss, much more attention should be given to the early diagnosis and treatment of glaucoma in prevalent countries and regions, and that every modifiable risk factor should be identified and reduced for a lower burden of glaucoma. According to a 2002 Prevent Blindness America survey, it was found that blindness ranked third after cancer and heart diseases as people's major fears. Only 20% of people knew that glaucoma was related to elevated pressure within the eye. Most of respondents mistakenly thought that people could tell if they had glaucoma due to symptoms, or that it was easily cured, or that it did not lead to blindness. Also, experts say that systemic diseases such as hypertension, diabetes mellitus have been linked with the prevalence and incidence of persons affected with glaucoma.
You are the master of your fate and the captain of your soul. Go for an eye examination today, as glaucoma has no symptoms. It can be blinding. Let us join our resource person, Dr. Nasiru Danjuma Simon, a consultant ophthalmologist, to explain further on glaucoma. Open your mind like a parachute, which functions better when open to the information from our experts. Stay tuned.
So for glaucoma, we are not even talking of the lens. For glaucoma, what we are talking about is the retina and the optic nerve. Once an information is passed from this place to the back of the eye now transmitted to the brain. So to the back of the eye is very, very important. And most of these yellow things you are seeing here, they are nerve fibers that goes to the brain, that sends information to the brain. The textbook will define glaucoma as a group. It's a group of disease. If it's large, it's a group of disease. And what you find common in this group of disease is what we call optic neuropathy, which means there's an inflammation of the optic nerve. So as the inflammation goes on, if nothing is done, it starts killing the nerve gradually. That's why it is said it's one of the commonest causes of irreversible blindness, because the blindness caused by glaucoma you cannot reverse, because any damage to this nerve is permanent. Any damage to this nerve that supplies there is permanent. The nerves, they are nervous tissue, they cannot regenerate themselves. Like any other part of tissue of the body, like you have your skin, once you have an injury, it heals. But the nerve supply to the eye, they are nervous tissue, they are special, they don't heal once they are destroyed. The way the eye is done is a closed environment. So what happens is that there are certain fluids that are produced by the eye, that bathe the inside of the eye and clean the eye. We call them the aqueous. They are produced by what we call the ciliary body. The ciliary body somewhere around here, from the back of the eye there. So when they are produced, they now pass through this hole, the pupil, and come into this space we call the anterior chamber. So right here, they are lined what we call the trabecular meshwork. So every fluid that comes out from the back of the eye comes out through here and enters here. So you see this small groove here, we have what we call the trabecular meshwork. Those are where they are absorbed. They are absorbed and then they now go into the external veins of the eye. So that's how the fluid. But we now discover that in certain individuals, those channels are blocked. And once those channels are blocked and the fluid is not coming out the way it is, what happens? Pressure builds up in the eye because the fluids are not coming out. So the pressure builds up. And once the pressure builds up in the eye, it starts compressing on the optic nerve. And the optic nerve is so sensitive that any small pressure change affects it. So that is basically what's glaucoma. So some people have predilection, to their angles not being open. So fluids do not pass through. So the pressure of the eye builds up and it starts impinging on the optic nerve. So that is basically what glaucoma is. It's a pressure thing. It's just like hypertension. When they say you have the pressure in the blood has gone up, and then we see that once your blood pressure goes, it starts affecting your heart, your kidney, your eyes, and other places. It's the same thing with glaucoma too. Once the pressure of the eye builds up, it starts impinging on the nerve, and then we say you have glaucoma, and then the features of glaucoma start developing on that optic nerve, and you see them. So usually when a patient that has glaucoma comes to the hospital, the first thing you want to do is probably you want to see how far he's seeing. So we'll check the visual acuity first to see where. Then we want to check the pressure of the eyes. That's why I say you come to the hospital so that they check the pressure of your eyes. That's very important. So usually when you have a family history of glaucoma, we say come to the hospital so that we can examine you. So they will check the pressure of the eyes. And the pressure of the eyes, there are certain level you should not pass. So in the hospital, we use 21 millimeters of mercury as the level. So anything above 21, we'll start suspecting that you may be having glaucoma. The various types of glaucoma, like I said, they are wide. They are broadly divided into childhood glaucomas. We now have what we call the primary glaucomas and now what we call the secondary glaucomas. Now, the primary glaucomas, usually, when you look at the eye, you don't find anything abnormal. You don't find anything that is causing this, so that's why they're called primary. It's just like when you have primary hypertension, you say, hypertension. When you look at everywhere, you don't know what's causing that, but the person has hypertension. So it's the same thing with glaucoma. But when we say secondary glaucoma, there is something that is causing the glaucoma. So we say it's secondary. When you are a child and you have glaucoma, we say you have childhood glaucoma. So those are the broad, classifications. So there are many classifications. You can, from the primary to, you can have what we call an open angle, a closed angle glaucoma. Those ones are other tests we do to find out whether it is open angle or closed angle. The secondary to, you can have open angle, secondary open angle, secondary closed angle glaucoma. The secondary glaucoma, there are a lot of causes. That one is further divided into pre-trabecular, trabecular causes, and post-trabecular causes. And based on the classification of primary glaucoma, so there are other glaucomas that people will still have optic neuropathy, yet their pressure is normal. You have normal pressure, yes, you are losing vision. There's a category we call normal tension glaucoma. It's also another category. So usually when such patient comes, even when the pressure is not high, we still try to treat them and bring down the pressure the more. Because if at that pressure that is normal, they are still losing fields. So the next thing is to treat them to bring the pressure more down to see if the destruction at the back of the eye may stop. So what are the risk factors? A lot of risk factors to developing glaucoma. In fact, if you take as risk factors for childhood glaucoma, there are risk factors for primary glaucoma, there are risk factors for for secondary glaucomas. One is age. Age. It is said that above the age of 40, of the population, there are about 2 to 3% of people with glaucoma. So what that means is that in every 20 person, there is one that has glaucoma in our environment here. So it's an aging disease too. So you have just like cataract is an aging disease too. And so you also have your eyes checked for glaucoma. Race, they say, is more common among the blacks compared to other races. Then people that have some refractive errors, like short-sightedness and long-sightedness, that is myopia and hypermyopia, they are also prone to glaucomas. While the myopias, they are prone to what we call acute angle glaucomas. The myopes are prone to open angle glaucomas. People that are hypertensive, that are on hypertensive medication, sometimes the pressure, because they are on hypertensive medication, the pressure goes down very low. So they may have what we call systemic hypotension. That too has an effect on the level of pressure in the eye too. When anatomically the eye is small, could be predisposed to glaucoma. Family history, very, very important. When you have somebody in your family that has glaucoma, you should have your eyes checked. It's very, very important. If you have trauma, something has hit you in the eyes in the past, it's better we follow it up, we check it so that because you can develop what we call a traumatic glaucoma in future. Then if you're having this kind of recurrent pains in the eyes, recurrent redness, there's what we call inflammatory glaucomas. If you've had chemical injuries in the past, we want to keep looking at the eye to see if you develop. Family history is very, very important because a lot of them have primary glaucomas already. You discover a lot of people that come here with glaucoma, they already have family members that have glaucoma. So that's why when they come, we want to find out if you have a family member that is blind. And that's one of the questions we want to know, to find out if you have a family member that is blind. If you are diabetic too, there's what we call neovascular glaucoma. Diabetics, they come down with neovascular glaucomas. Just like I was saying, they're telling you that diabetes is one thing that if you have, you must always have your eyes checked. Now, the good thing about all these glaucomas is that, one, it is irreversible once you have it. But what we can do for you is to treat the glaucoma so that we can manage. Once we say you have glaucoma, it is said that even in a normal human being like this, you see those nerve fibers I show you, those nerve fibers. As you age, you lose those nerve fibers. So it is said that for a normal human being, you lose about 0.68 micrometers of those nerve fiber every year. But when you have glaucoma, you lose almost 0.95 of those nerve fibers every year. So you see the difference. So once we discover you have glaucoma, we want to start your treatment so that we can bring you back to that rate of progression, the normal rate of progression, as close as possible. Because if we leave you at that glaucomatous rate of progression, you will lose those nerves within a few times, so that before you are old, you are already blind. The only thing we can treat when it comes to glaucoma is to see how we can control the pressure of the eye, because that is the primary thing that is causing the destruction there. So we have various type of medications that we actually give to lower the pressure of the eyes. So usually when the patient comes, once we've done all the investigations we need to do for the patient, and we've known how far it has been, there is a test we call the central visual field. It now tells us how far of the peripheral vision have been affected. There's a test we also call the OCT. When the glaucoma is early, we can also pick it as an early using the OCT. So you can come here now by the time we check and discover that there are some of the things we are seeing at the back of your eyes that show that you have glaucoma. There are other investigations we do. Once we do, we collaborate everything and say, okay, you have glaucoma. So this is our management plan for you. So it can either be medical, it can be surgical, or it can be the use of laser. So usually we start with medical when they come like that. We start with one drug, we start with the second drug, we start with the third drug. If by the time we're giving you 3 drugs and we discover that the pressure is not coming down, the next thing we do is to advise for surgery. But there are some that may just come with usually moderate to severe. When we look at your age, like for a child or a young boy that's coming with moderate to severe glaucoma at that age, you can't tell him to be using eye drop continuously. There are children, most of them may even forget, so probably we offer them surgery immediately. Then there are some that the glaucoma is already advanced. There's nothing you can do because such people, you don't want to do surgery for them. There's what we call wipeout syndrome. If you are not careful, they will lose the vision of their eye. So such people, we don't do surgeries for them. We just manage them on medications and we see them regularly. We can be seeing them monthly, 2 monthly, 3 monthly. So as they come, we check just the way you treat your hypertension. As they come to the clinic, we check their pressures. We make sure the pressures are controlled, and then we keep on seeing them like that for follow-ups. The best thing for glaucoma is just to pick it early. It's just the best way. Just pick it early. If you pick it early and treatment is treated, they do well. Once the rate of progression has been slowed down, they do well. They live with their vision till they are old. In our society, the problem we have is that most of them don't come early. You see those optic nerve that are coming out from the back of the eye. God has so blessed us with two eyes that if you are not careful, one eye may not be seen, and because the other eye is overshadowed, you may not know. So once in a while, close one eye and see how far you can see, and then close the other one and see how far you can see. That is number one. Number two, with glaucoma, it is called the silent thief of the eye. Why it is called the silent thief of the eye? It just creeps in gradually. You don't know. And usually before you start noticing that your vision is being affected by glaucoma, 40% of those nerve fibers will have gone. That is one thing with glaucoma. That's why a lot of them present late. A lot of them at that level, when they notice their vision going down, they start coming. And some may not come. They may just stay until when it is far, far advanced, when they've lost majority of the nerve fibers. Once you've lost those nerve fibers, the aim of the treatment now is not to recover those nerve fibers, because they are dead. You can't recover them back. So the treatment we are giving you now is to make sure we maintain the nerve fibers that are remaining so that they don't go as fast as the other ones. So that is just the basic treatment for glaucoma.
In the words of Tammy Doughton, discovery consists not in seeking new lands, but in seeing with new eyes. Up to today's edition has given you a new vigor to giving priority to your health, wellness, and well-being. Remember, you can watch this episode as well as previous episodes on our YouTube page and other social media handles displayed on the screen. Join me next time on an equally enlightening episode of Better You Today. My name is Yetunde Jayola. I will leave you with the words of Monali Patel. Doing what you like is freedom. Liking what you do is happiness. Be happy, stay safe, and bye for now.